Hello, my name is Samantha Parsons, and this is my philosophy of healthcare and nursing. A little bit about me. I live in Kent, Washington, and I've worked in Seattle as an operating room nurse at Harborview Medical Center for 8 years now. Um, I've learned so much during that time frame, and I think it's really helped me to develop my viewpoint on what nursing truly is and how um, it's shaped my philosophy of the healthcare system in general. I'm also the wife and a mother to two little boys who are 3 and 4. My primary goal, especially as an OR nurse, is always to establish a good, trusting relationship with my patients and their families. Frequently, because of my specialty, I go and talk to a patient for maybe 10 minutes, and in that period of time, they really have to essentially trust me with their life. Um, I may be their nurse for 30 minutes or for 15 hours, and I have to get their family to trust me and know that I'll make good decisions on behalf of their loved one while they're unable to. And in doing this, I mean, you really have to display that it really isn't mattering to you where they're coming from, that you will treat them like they were your family, like they were your best friend, and you will provide that level of care to them. um, I think this is one of the most important things I can possibly do as a nurse, is develop this relationship with my patients. Advocacy is one of my primary goals in nursing. Not only to advocate for myself and my coworkers and the healthcare system, to ensure that I'm providing the safest care possible, and that people are empowered to speak up about issues of safety and the wellness of our patients and our staff. Also, I think advocating for yourself includes, making sure that you're up to date and take opportunities for learning and for professional and personal growth. Um, Along those lines, too, advocating for the patient is obviously my primary concern. I believe I'm providing the highest quality of care to them, and I believe they deserve that. And if they can't advocate for that themselves, then it's my job as their nurse to ensure that I do it. If they're not able, which they especially aren't during surgery many times, it is my number one my number one goal is to be the voice for that patient for the length of their surgery, that they're unable to communicate for themselves what their needs might be. It's my job to anticipate what those needs might be and make sure that they're met. With regards to accountability, I really think this is an important factor in nursing and in healthcare. Being accountable for your knowledge and the things that you don't know, and getting that help or that advice and education when you need it, is of utmost importance. And basically, you need to also consider, who are you delegating these tasks to, and are they capable of doing what you've asked of them? And if they're not, are they feeling comfortable to communicate that with you and ask questions? Um, I think that being a trustworthy person and being a trustworthy nurse includes all of these things, and it's definitely high on my priority list for. Autonomy in nursing, it's my goal to ensure that these patients have the ability and the knowledge to make decisions for themselves if they're able to. And if the patient's unable to make these decisions, then it's my job to make sure that their family has the information they need to make good decisions for their loved one. And I also have to acknowledge that each person or each family has the right to accept or refuse care, or to end care as they think they need to. And I have to respect that. And even if it's going against what I feel like they should be doing, or my personal beliefs, then I still have to support them through their decision-making process and support their decision in the end and carry out their wishes. Prevention and education is something near and dear to my heart. I think, especially working at Harborview, you see injuries and illnesses frequently that are preventable and that we could be doing more to avoid. I've gotten on a soapbox frequently with my family and friends about helmet safety and buckling your children into proper car seats and wearing your seatbelts properly. I think it's one of the easiest things that we can do to protect ourselves against traumatic injuries. Also, with regard to preventing illness, taking care of yourself and really, promoting everybody to have a healthy diet and get some exercise and get help with things that they need help with, like drugs and alcohol, and tobacco cessation included, and hopefully avoiding risks for complications from all those things. In general, my philosophy on nursing has adapted tremendously throughout the years. I have just realized that the most important thing that I can do for somebody is to advocate for them when they can't advocate for themselves. And it's my job, if I think somebody's making a choice that might not be wise, to either provide them with information that they might be missing, or to stand up for them if somebody else is making a questionable decision on their behalf, and that includes other healthcare providers. I also need to respect the patient's right to autonomy, and after they've gained all that information and they have made a decision for themselves and what works for them, to respect that decision and to allow them that space to make it. Being accountable for my actions and those I choose to delegate to, I think, is really important. Obviously, we all make mistakes and we all do things that we can learn from. And I think it's important to be accountable for your mistakes and to learn for them and make sure that you get that education and provide education to others so that these things don't continue happening. Hopefully, if you did it and you talk about it, you can avoid it for somebody else. The other thing is being open to new points of view and information from not only my patients, but from my teammates. There might be something about their life that I'm missing and that would allow me to provide better care for them. And I need to be open to hearing those things. And also, I need to be open to hearing my teammates' opinions, and even if they conflict with my own views or my own ideas, and to compromise with them, and let's come up with the best solution for this patient. Being flexible and adaptable is of utmost importance, I think, in nursing. I think that, in order to just maintain your own sanity, you have to, just practice being flexible and adapting to situations that you just did not see coming. When that patient codes and you had no idea it was going to happen, and especially in surgery, sometimes you just don't see events coming and they come on so suddenly, and you have to jump right in and do what is best for your patient and for your teammates. And education when possible, to prevent needing to treat these people. I think that it just could save us all a lot of trouble, and I guess that's my philosophy of nursing. I thank you for listening, and I hope you have a great day.